So we're going to wait here a minute and see who we get to join us. Welcome, welcome, everyone. Happy Friday. My name is Heather. I'm a therapist here with NOCD, and we have.
Hi, I'm Jamie Fall. I'm a therapist here at NOCD and a clinical advisor. Been here about 4 years, located in Florida, and I also have a license in Ohio. Where are you at, Heather?
I am also in Florida. I am located
Oh,
in Central Florida,
me too.
um, and I am licensed here in Florida, New Jersey, and Arizona.
Okay.
Yeah, so we're
Okay.
just going to welcome everyone in. Thanks for joining us. Going to give it a minute or two, and then we're going to get right into it. Talking today about health anxiety and health OCD. It looks like we've got some people
Got some
from
Florida.
Florida. Go Florida.
Nice and hot here today already.
Yes, yes.
All right. Oh, Washington State. All
Yeah,
right.
welcome, Washington. All right. Well, we will maybe get rolling here so
Yeah.
we're not keeping people waiting too long. Did you want to get us kicked off, Jamie?
Yeah, sure will. So today we're talking about health anxiety. This can mean a few different things, but really we're kind of referring to that anxiety that's really surrounded specifically about health. That can be excessive thoughts and fears that maybe somebody has about developing a serious illness or even of already having one, or maybe even of giving one to somebody else. It's often associated with people who have certain diagnoses as well, and we'll talk about a few of those just briefly. But one would, of course, be OCD and some of its subtypes. But there's also illness anxiety disorder and somatic symptom disorder. And I don't know if you want to start off, Heather, just talking about maybe the somatic and the illness and go from
Yeah,
there.
absolutely. So when we talk about all of these symptoms, they all kind of overlap one another. And really, these terms are just to help us as clinicians to kind of determine what is the best treatment, what is the best direction for us to go with. When we're talking about illness, anxiety disorder, somatic symptom disorder, we're talking about people who have a lot of anxiety about getting a serious illness. There can be compulsive like behaviors, but we're not seeing the intrusive thoughts and the compulsive kind of ritualistic behaviors associated with it. Things that people may do with illness, anxiety disorder, they may kind of go to Google. We all like to go to Dr. Google and get some advice from there. Uh, we can see people seeking reassurance from medical professionals, from family members. We can also see people kind of doing body scans to say, oh, what's that? Maybe I need to get that checked out. But we don't see it occurring as frequently or as persistently as we see with health OCD. And you want to talk a little bit about health OCD, Jamie?
Yeah, so OCD, we we often hear about subtypes, right? And there's two pretty common subtypes that I think people would associate, I would say, with having some health anxiety. One of them is health concern subtype. That's where people are very preoccupied with the fear of having a serious illness despite medical reassurance that they're healthy. This might include things like checking your body for signs of illnesses and seeking reassurance from healthcare providers. And, sort of the contamination OCD, which is one that most people know about and is commonly associated with OCD. And that's, of course, that excessive fear of germs or other contaminants that could make you or someone else sick. And we often see compulsions such as excessive hand washing, avoiding public spaces, excessive cleaning, things like that. But there is a difference between OCD and especially illness anxiety disorder, but they can also look very similar. I mean, they both have you know, unwanted thoughts that come with them.
Mhm.
They both involve, sort of that focus on health concerns. And for both, they often cause, problems in functioning, including relationship issues and leisure activities, important, daily life activities. So very debilitating, of course. But there are some key differences as well that you might want to know about. So maybe Heather, you can take those.
Yeah, absolutely. So some of the key differences is with OCD, we have intrusive, unwanted thoughts, images, and urges. These unwanted thoughts, images, and urges are going to take up more than an hour in someone's day. And in response to those thoughts, images, and urges, people engage in compulsive, ritualistic like behaviors. Sometimes we see the logic between the thought and the action. Sometimes we may not see how there is a bit of a connection. Sometimes people have the insight and will say, I know this is silly, but I just feel like I need to do it. So I have a fear of becoming ill. I think I'm going to get HIV from the doorknob. I'm going to tap 3 times on the door sill in order to avoid experiencing that. So we are looking to relieve distress in doing the compulsive behavior. Whereas with health anxiety, we don't see people doing the compulsive behaviors. They're compulsive like in nature, but they aren't directly in response to intrusive thoughts, and the behaviors themselves aren't compulsive in nature, and often are related to the worries that the people are experiencing.
Yeah, I think one of the differences too, like they both may, seek, reassurance, from a doctor, but somebody with OCD will do things in a more ritualistic way. So if they're going to take their temperature, they're not going to take their temperature multiple times. They might take it at specific times a day or before they do certain things. They might do it repeated 3 times, and if they miss a part of the ritual, they often have to go back and do it again. So that looks
Yeah.
very different from somebody with just an anxiety illness disorder or things like that. So OCD definitely has that ritualistic kind of content to it that shows up for sure. Yeah,
Absolutely.
yeah, very very
Absolutely.
unique situation. Yeah.
Yeah, and you bring up some really valid examples of what compulsions can look like. And here we are in cold and flu season, and this might kind of bring up some of anxiety for all of us. We may all kind of fall victim to, oh, do I need to wash my hands? Do I need to Lysol the doorknob sort of thing? But when we're talking about health anxiety and we're talking about health OCD, those concerns far exceed what maybe the kind of average person um, may experience. And so when we are trying to provide some seasonal advice to folks, we want you to take things as they are intended. So get your vaccines, wash your hands maybe after you are out in public or before you eat a meal, get your flu shot, staying home if you're sick. When we are talking about OCD and health anxiety, it can kind of go in different territory. And you want to pick up there, maybe, Jamie, and talk about how it differs from kind of taking reasonable precautions versus maybe more compulsive or compulsive-like behaviors?
Yeah, so people, we want you, right, to seek, for example, medical attention when it's necessary. So a healthy thing to do is if you notice, oh, I've got these set of symptoms that sort of weren't there before. So I think of these kinds of symptoms, especially that are maybe new or are persistent or very prevalent. There's some evidence kind of showing that, yeah, maybe visiting the doctor would be a great idea. And so you're going to make that appointment. That would be a healthy thing. But a compulsion, might be I get a little tickle in my throat, and instantly I'm like, I've got to get to the emergency room because I probably have throat cancer now, or something. So it's sort of maybe a reaction that's a little bigger than what's called for, or more urgent than what's called for. So we don't want to necessarily avoid going to the doctor, but not repeatedly going or repeatedly calling the doctor multiple times for reassurance, even though they've already said and the tests have all said there's nothing there. Just to kind of keep that up and keep going would be more of a compulsion. And that includes, even things like hand washing. Is it a good idea to wash your hands, especially during cold and flu season? Yes, and everybody's going to hear that advice being thrown out there on the
Right.
TV or social media. For someone with OCD, those CDC guidelines for 20 seconds in warm soapy water. If 20 seconds in warm soapy water is good, maybe I should do it double or triple or quadruple that. Or maybe I shouldn't do
Right.
it just one time. Maybe I should do it, 15 times. And maybe I better be really careful about, let me start with this finger here and then this one and, get at the front. And then, so it's done
Right.
sort of a ritualistic. And again, they get caught up if I miss something, I better start over because I can't miss that. But, so we want
Right.
you to wash your hands, right? After you've,
Right.
been in public for a while or before meals or after you use the restroom, like those are very important things to do. And you might do it a little more frequently during cold and flu season, but not excessively, to the point where, and this is something that happens, unfortunately, with people with these health, anxiety issues, where you wash so much that your hands are actually dry and cracked and maybe even bleeding, which, ironically, actually makes it more likely that you're going to get some kind of infection and things like that. So overdoing
Inflation.
things like hand washing actually can be, harmful and not helpful. So again, it's just taken to a level that's just not necessary. And another thing is, is it okay to avoid being around people when you're sick? I think, yeah, there's some logical times, right? Like stay home if you have a fever or you're vomiting,
Mhm.
those kinds of
Right.
things.
Right.
But someone with OCD, might sort of isolate for hours, days, weeks, during COVID years, so
Yeah.
that usually isn't necessary. Or they excessively clean, sanitize when somebody has visited and leaves. So it sort of makes the enjoying of that experience of being around people pretty miserable because they're already thinking about all the things I've got to clean and sanitize. And then there's this constant ruminating, so you're not even sort of present, so
Yeah.
yeah.
Yeah. Absolutely.
Yeah, I think, is it good to educate ourselves about healthy skills? Yeah. So understand what CDC guidelines are, things like that. But the compulsion might be Googling for hours and hours and going to different, websites and checking the sites again and again and repeatedly. And that's what would be sort of over the top, so.
Right.
I guess the
Right.
good news about all of this is there are some things that we can do, right? There is treatment available for these types of issues, both OCD, illness, anxiety disorders. There's good treatment, and even though the diagnoses are different, have fully different criteria, it turns out the treatment is the same. So maybe you could kind of kick us off talking about that treatment.
Yeah, absolutely. So, ERP, exposure response prevention therapy, is our go-to therapy when we are talking about treating illness, anxiety disorder, somatic symptom disorder, or health OCD. So when we are talking about ERP, we are exposing ourselves to the things that are triggering, and then we are not responding in the way that we want to. So if we hear someone cough and sneeze, we are going to do our best to maybe not sanitize our hands immediately or exit a space. We are going to sit with that distress, allow it to be there, but also allow it to pass without giving in to rumination or reassurance seeking, avoidance, self reassurance, telling ourselves everything's going to be okay. And in that manner, we achieve something called habituation. we start basically a new habit. We do things differently. And we do this enough times over, we start to notice that that distress, even when we're triggered, goes down over time. It may not go away altogether. That's not our aim. We do want you to have healthy ideas of what's appropriate and what's not appropriate. So we're not trying to remove your anxiety altogether. We are trying to help you be able to manage that anxiety or that distress more effectively. That over time, hopefully, if you do hear someone sneeze or cough in a space, you aren't feeling immediately that need to engage in a compulsion. ERP is often seen as scary by a lot of people. They think that we are going to ask people to do things that we ourselves wouldn't necessarily do. I often tell people that I am afraid of heights. I am not going to tell you to go stand on a tall building and look over the edge, because I am not willing to go to a tall building and look over the edge. Everything that we ask folks to do is going to be in a safe manner. It is going to be in a collaborative manner, and it's going to be in an individualized manner. And we take measured steps to work towards more difficult things. So we're not dropping you off at the end of the deep end of the pool. We are working with you in order to achieve those steps each step of the way. So, rest assured, we're there to help and support you, not scare you or have you do things that are unethical, illegal, or could harm you in some way, shape, or form.
Yeah, yeah. And I think just an overall reminder, right? The goal of ERP won't be to be reassured, right, that you'll never get someone sick or that you'll never get sick yourself. The reality is we will be getting sick sometimes, and sometimes it's true. We will actually get someone else sick, and those are tough, but they are to be expected at times. But really the goal is, in times when you're not actually sick, right, is to really just help you live, your life the way that you want, right, in line with your values. Like, maybe I want to be spending time with my family, but my OCD or health anxiety in some ways is saying you can't be around them because you're going to hurt them. And so then I'm spending way more time apart from family than I really want to. But we want to get you back to doing the things that are really important to you. Maybe like spending time with family, without being ruled by these unwanted thoughts, right? Because it turns out these thoughts can be really, really scary and feel really, really real. But, we have to remember thoughts are thoughts, and we don't actually have to believe fully all of them, right? They may not be reliable thoughts. These intrusive thoughts are often not reliable. We can't be certain if they're true or not. But I think the goal of therapy is just to really help us all live with a little more acceptance of uncertainty in our life, and be willing to do some brave challenges, to take some risks in order to live that kind of life that you really want to live. Yeah.
Yeah, absolutely. And OCD is always after certainty. It is looking for a guarantee when it comes to these unwanted thoughts, images, and urges. It wants to know for sure that if I do this compulsion, then I am absolutely going to keep my family safe, or I am not going to get sick. Um, so a lot of the work that we do, as you mentioned, Jamie, is working on uncertainty and the acceptance of uncertainty, because we accept uncertainty all over the place, right? We don't think too much about the uncertainty that we accept in a lot of areas of our lives. It's just that OCD and anxiety like to grab onto a small piece of the pie and say that uncertainty is unacceptable in these realms.
Yeah, that's funny. That's why OCD, has different subtypes, because different people's OCD helps them attend to specific things. Somebody may have contamination OCD, but they don't worry about some of the other subtypes. So those thoughts that come in, they cause us to attend or focus on something in specifically. But that's where we end up learning, right, that we have some control over that. We can have a thought, notice it, but we don't actually have to turn towards it and attend to it all
Yeah.
the time. We can actually let it be there and still choose to go towards what we want, even if we're doing that with a bit of anxiety. And the goal is, as you go towards what you want more often and less towards what those thoughts are telling you must attend to, then it gets a little easier to do that, and the anxiety goes down a little bit. It's not quite as triggering because there's so many triggers out there now, right?
Right.
We're gonna see more news stories, on the
Yes.
news. We're gonna and there's everybody's always willing to tell us what the newest illness is out there, where it's at, how prevalent it is, and it's hard to sort of not see those things. And
Right.
you're going to have family members that are sick, or you're going to be exposed to coughing and sneezing. So there's no shortage of triggers for sure. It's just a question of when we do get triggered, with treatment, you can learn, yeah, I feel that fear. I feel that, I hear that thought. I see it, but I maybe don't have to do anything about it right now, maybe even delay it, or maybe I don't ever have to do anything about it. Maybe I can just continue to do what it is that I want to do. Yeah.
Yeah, absolutely.
Yeah.
Well, we do want to open it up to questions, make sure that we are answering the things that you want to hear about and learn about. And it looks like we have a couple of questions in here. And so, Jamie, I can start with the first one here and
Okay.
read it off. Would this fall into health OCD category? Noticing heart rate, hearing that your heart rate isn't correct, breathing isn't normal, and checking pulse repeatedly. What do you think, Jamie?
Yeah, I definitely. This is pretty common here. And interesting. These are also sort of just anxiety symptoms as well. And so a lot of times people with OCD or other illness, anxiety disorder, yes, when you notice a change in a physical symptom in your body, right? Just like
Mhm.
my heart rate is going faster, it's going up, or I'm warm, or I feel a tightness here, or a wiggle here, right? Very frequently, OCD, unfortunately, makes us want to sort of overestimate or really focus in on and attend to, and make that mean something that may not mean much at all, right? And of
Right.
course, OCD is always happy to tell us what to do about that, right? Why don't you check that pulse? Why don't you take your temperature? Why don't you not move? Why don't you take deep breaths? Why don't you, right? And it's sort of a trick, because as soon as we do those compulsions, those things to try to make ourselves feel better, it puts us in that cycle again. It makes it more likely the next time you have one of these symptoms that you're going to do the same thing. And this is why people get caught in that cycle, and it's so hard to stop, right? Because it
Right.
makes you feel good for a minute to, like, no, my temperature's fine, I'm okay, or you know what, my heart rate is still normal, it's all right. But then when that happens again, you're going to want to do the same thing again. So yeah, absolutely. In fact, we actually have a specific type of ERP called interoceptive exposures that we will often do with people
Yeah.
who are very sort of hypersensitive to changes in their physical sensations. Even people who have like panic symptoms, we can sort of do things like, purposely get your heart rate up. So we might have you do some exercise, run in place, for example. Notice on purpose, I've just made my heart rate go, really fast. And that may cause, and it often does cause people anxiety. But after a while, you start to notice, yeah, I can make my heart rate go up myself. And after a while, it just goes down. I don't actually have to do anything about it. And then when you get sort of random, increases in heart rate and things like that, you start to become, again, kind of desensitized to it, kind of habituated to it. You start to go, yep, that's my heart rate going up. And then I just can keep going on with my day after a while. So it's pretty cool. Those work really nicely. Yeah, so,
Right.
yeah.
Yeah. Yeah, absolutely.
Yeah, we've got another question that looks like just Let's see. Yeah, so this one, if you get sick and you feel much better, but the OCD says you have to wait 10 days to see anyone, that's an example. So just that feeling, that guilt, right? How do you get over that guilt? So you do this thing, right? Maybe you're brave and you do go, but how do you deal with that guilt? Or yeah, I think that's the first part of this question anyway. How do we
Yeah.
manage that guilt?
Guilt, it can come in a variety of forms, but that is a common concern, is that somehow I will be responsible for someone else's well-being. And we can't be certain, right? We can't be certain of whether or not we are the responsible party. Sometimes, believe it or not, guilt can actually be a compulsion for some people. If I feel guilty, then I know I'm not a bad person. I know I can prove to myself that I am a good person because I feel guilty about my behaviors. But guilt is often a self-inflicted emotion for something that we perceive that we've done. And a lot of times this is through just thoughts. And if we're guilty of having thoughts. We're not guilty of other actions. And so it doesn't often serve the purpose that we think that it serves. So having a little bit of self-compassion, having a little bit of understanding that, hey, this is my OCD, that I am not responsible for other people's actions, other people's outcomes. I am only responsible for myself. But yeah, guilt is something that we, do to ourselves and is unnecessary. So it's just kind of letting ourselves off of the hook. These are just thoughts. These are just images. These are just urges. We don't need to do anything with those, and nor do they have meaning outside in the real world.
Yeah, I mean, nobody wants to think, oh, I'm this kind of person who would purposely harm another person. So guilt can just be a natural feeling that comes too, because we don't want to be sort of bad people or irresponsible. And this is where contamination OCD and responsibility OCD subtypes sort of collide, I think, in a really tough way for people. So not only do I not want to get it sick, but then that feared outcome is often, and if I do, right, something terrible might happen to me, but sometimes even worse, what if, I harm somebody else? And so it just feels too much. It feels too risky sometimes to, you know, uh, you know, go out and be around people, even though people with your same symptoms probably would, right? So I think just noticing that feelings will come sometimes just naturally, and again, OCD likes to use feelings to motivate you to do compulsions, just like he uses physical sensations to motivate people to do compulsions. But we sort of just have to notice, I'm having this thought and therefore having this feeling that's pretty yucky, or maybe these yucky physical sensations too. The next part of the cycle is to do the compulsion, but that's the part that we have control over. So I can say, yeah, I'm feeling guilty. It's a feeling. I'm allowed to have it, but I don't actually have to do anything about that. So this becomes a matter of asking yourself the question, what do I want to do, right? Again, that focus. What can I focus on today? So OCD may say you must wait 10 days, even though there's no medical guidelines that say doing that. There were COVID guidelines and things like that gave us very particular timelines and things like that. And I don't know if you look today what those would say today. But usually, again, OCD wants you to go above and beyond, and that's supposed to be if you're actually, have something like COVID or things like that. But I have lots and lots of members with this type of OCD who it's almost like, but what if I do have it? So maybe I should just, stay in for 10 days because I heard somebody coughing, at my office or sneezing at my office.
Mhm.
So they probably have COVID, and so I probably have it too, and so you're sitting with that panic, you're sitting with, or that guilt, whatever it is, and we sort of just have to let it be there and then decide, what is it that I want to do? Well, I want to see my mom. I don't actually have COVID. I'm just afraid of it. So this is where bravery comes in. We have to do these little bravery challenges, otherwise known as exposures, where it feels like we shouldn't do something, but we're going to do it anyway. And we're going to allow those feelings to be there until they start to go down. And OCD says they never will. You're going to feel like this forever, but you probably already know that's not true. Yeah.
Yeah, absolutely. Well, we have another question here. I have emetophobia. I was wondering if that could be connected with health anxiety.
They definitely, they're different. I mean, they have, different criteria, things like that. But yeah, oftentimes, oftentimes, I'll have people with both really. So not only are you having contamination OCD, so you're worried about getting sick or germs, things being contaminated, but then this other thing sneaks in there. And then if I really do get sick, what if I throw up? Because for some, that fear of throwing up just adds a whole nother layer. So they're definitely connected. They're definitely connected. And during this time of year, I do have my people with emetophobia who are really struggling because they might even see a family member throw up because they've got the flu or things like that, which is just, definitely very, very triggering. And just hearing about that possibility that vomiting is a symptom, right? So I really better do all these compulsions so I don't actually get sick because I do not want to throw up. And again, the treatment for emetophobia is the same as well, right? We
It is.
create a whole hierarchy, a whole fear ladder, right, of activities, brave challenges that you can do to sort of start to face that, including things like, just hearing a throw up sound at first, and then maybe seeing a cartoon throw up, all the way up to we're sort of making a fake concoction of throw up and practicing throwing up in the toilet. These things sound terrible, but I promise you, when you're in treatment, again, that safety thing, right, and that
Yeah,
collaboration thing that you mentioned, Heather,
right.
we're,
Yeah,
we're not going to make a hierarchy for you. We're going to do that together, and we're going to make doable, small, challenging but doable steps. And even when we get to a step, if someone says, nope, not today, right? Then we
yeah,
don't do it today. We try to
yeah,
go back on a step like that. So emetophobia, yeah, they can definitely be connected. But again, thankfully, the treatment is the same. Yeah.
yeah. Absolutely,
Yeah.
absolutely.
Mhm.
In addition to ERP, are there medications recommended to address OCD disturbance? Yes, there is a wide variety of medications, but that is out of my scope of practice. I am not an MD. And so what I would recommend you to do is to consult your GP or with a psychiatrist and have them kind of talk to you about the different kinds of medications that are available. But if you are looking for a resource to maybe read some reliable information about medications that treat OCD, I would direct you to the IOCDF
Mhm. They have
website, the
some
International.
good articles. In fact, they even talk about the necessary doses that it might even take. Yeah, and
Yep, yep,
because unfortunately, we already know not all therapists are well versed in OCD, but unfortunately, some doctors, some psychiatrists are not either. So you want to educate yourself about the medications as well. But you're right. We don't give advice about which medications or how much or any of that. Yeah. But
yep,
thankfully, the research has shown that for many, gold standard ERP, that's tops, right?
yep, yep.
Next might be a combo, right, of ERP and medication, and then medication. So that's kind of how the order it goes, research wise, anyway.
Yep, absolutely.
Mhm.
Absolutely. And I saw in the chat I didn't realize we here at NOCD have some information about medications that are used. So yes, thank you for posting that. But you can get some guidance there. But always follow up with your GP or your psychiatrist to make sure that you're getting personalized advice as to what would be appropriate for you.
Yeah.
And let's see. Do
Got
you want
another,
to?
yeah, we've got another one. Let's see. I thought I saw, oh, somebody, okay. Somebody here says, I want to ask how to effectively respond to intrusive thoughts when you have previously had an illness. That could be probably an illness such as cancer, things like that, because we know people do get sick sometimes. They do have genuine illnesses that are actually diagnosed, and so then, even though maybe that is in remission, certainly people with health anxiety, OCD, things like that, of course OCD is going to pick on that, of course, because there it is. He's kind of like an opportunistic bully, right? Oh, you've had
Yes.
this serious illness before. Now, right, I'm going to give you this intrusive thought when you see a commercial about, cancer, or you see, whenever you get triggered. So, yeah, so what do you do when you get triggered, right? Which means you get that intrusive thought, which of course, what happens next is, for most people, you get some kind of, not so pleasant feeling, including, fear, or anger or guilt or shame. It can really be any feeling. We most usually associate it with anxiety or fear, but it can be really any feeling. And then, of course, they're going to be tempted to do something about it. So what do I do about intrusive thoughts? The short answer is nothing.
Yeah.
And that's so
Nothing.
hard. So, but maybe it's not that simple, right? When I say nothing, I mean, we don't want to do anything to try to make that thought go away, or anything to make those feelings go down quickly. We really just want to, we can notice that the thought is there. And we want to stay uncertain about them, right? Because you know what? It's true. If you've had cancer 10 years ago, does cancer ever resurface? Unfortunately. Unfortunately, it does sometimes, right?
Yeah.
But if you think about that, OCD wouldn't care if every day of your life you thought about getting a resurgence of your cancer all day long, every day, which would mean even though you don't actually have cancer today again, which is lovely and great and to be celebrated, OCD can make your life as miserable as if you did, right? So he's really, again, we're attending to things that I don't know why I call OCD a he. Maybe not everybody does that, but I kind of think of it as kind of a separate entity. But OCD will get you attending to this, when really the fact that you beat cancer even one time, right? And it's not here today. What do you want to do with this day that you have, right? Because you got through that tough time, and that means you got a second shot at living, right? OCD doesn't care about that. Illness anxiety doesn't care about that, right? It's just about do something about this thought. We don't have to do anything except maybe think, what am I going to do to enjoy this life that I have today? What am I going to do to really celebrate that I am alive today? Yeah. And so sometimes we use these uncertainty statements that kind of help us to stay uncertain. I think we call them response prevention messages, but like, so if I got a thought like, oh, what if this tingling, in my body means the cancer has come back? And one would just be to kind of notice that you're having some feelings about that. And then maybe say something uncertain to kind of keep your brain uncertain, because OCD will say for sure you've got cancer again, right? When the reality is we don't know that. So maybe the cancer has returned, maybe not, but I don't know that for sure. So I'm going to go ahead and go outside and play with my kids for a little bit. Yeah. So
Yeah.
you
Yeah.
can actually tell OCD what you're going to do instead of whatever thing he wants to do, like look it up or excessively check, or right when you already have regular doctor's appointments scheduled, and things can wait till then. Yeah. So
Yeah.
unless you have evidence that is, like I said, there's something new, something persistent, something pervasive, it's so clear. If you're bleeding out of your pores, go ahead and get to the doctor, right? But
Yeah.
unless that, with intrusive thoughts, we want to really sit in that uncertainty and allow it, but then keep moving forward with what you want.
Yeah. Yeah. In regards, just to add on to what the individual was asking the question, in regards to what symptoms are worth reporting, ask your doctor. I always tell folks if you do have diagnoses that need monitoring, ask your doctor what are the signs and symptoms that are going to require maybe some additional steps. And if these things are manageable at home, taking reasonable steps. So if I'm experiencing a fever, maybe I stay home and maybe I rest a little bit. Maybe the next step would be I'm going to take some Advil and drink some water. And maybe the next step is to continue to monitor my temperature. But if my fever gets above, say, 103 and a half, that's when my doctor says that I need to go and get checked out, or maybe I need to go to the hospital if it gets up to 105. So whereas anxiety and OCD want to say fever equals ER, we're going to try to rein that in and take more measured steps before we maybe go to more extreme measures.
And I think if you're feeling brave, maybe even, talking with your doctor about the fact that I don't, if you have no, if you know you have OCD, or you have, even if you know you have just excessive anxiety around illness, that might be a good time to say, can you let me know what symptoms, if I have them, I should be reporting, right? And so you might even know ahead of time, because I already know every symptom I have, I'm going to want to report it. And maybe they
Yeah,
can let you know ahead of time. And because you always want to advocate for yourself for good health care, and we don't want symptoms to be ignored, or anything like
exactly.
that. That's
Exactly.
not okay. We know that that can happen. So sometimes you have to be a really good advocate. Um, but again, knowing which symptoms are worth reporting is a good
Yeah.
idea. And your doctor definitely can help with that. Yeah.
Yeah. Give you some guidance.
Mhm.
Um, Next one up. Let's see what we've got. From someone who had been a heavy reassurance seeker, but in recovery, shifted so far now to the other way where they become care avoidant. How do we find a way to be in a healthier kind of middle ground? What are some practical steps to take to re-engage in appropriate care? We often see this. It's an all or nothing kind of prospect, right? Either we are seeking reassurance or we're not seeking reassurance at all. And it can be very hard to find that happy middle ground between those two extremes. One of the pieces of advice that I often give my clients is, are we seeking reassurance for guidance, or are we seeking reassurance in order to make ourselves feel better? Or maybe are we seeking reassurance to make the OCD feel better? If that's the case, then maybe we need to take a step back and sit with that uncertainty a little bit. And reassurance all unto itself is not necessarily a bad thing. We do want you to be able to find a happy middle ground. It's just what direction are we going with seeking the reassurance that is important. So taking a step back before we do so can help you give a little bit of space before acting on the thought or the urge to seek that reassurance, but also gaining insight into what is the meaning, what am I trying to achieve here, right? And by doing so, you can hopefully kind of know what direction it's going in, but know whether or not it's a compulsive behavior that you're trying to seek, or if it is, like I said, guidance that you're trying to get. We all need reassurance. We all need to be told we're doing a good job every once in a while, or that we're on the right track. It's the kind of guidance that can be helpful. But if we're doing this repeatedly and we're trying to get, that good feeling, then it may be compulsive and we may want to pull back on it. So what are your thoughts, Jamie?
Yeah, I'm thinking, you know, yeah, so at first OCD is like you got to go to the doctor a lot, you got to get repeated tests, got to check, and we do see it's one end or the other, and now it's like you can't go at all, and so again that ends up being not your rules but OCD's rules. OCD is saying this, and so I really sometimes we have to stop back and separate ourselves from those scary thoughts, that OCD or that illness, anxiety, whatever we want to call it. It almost doesn't matter, but it's not us, right? What do I want? Can I give myself some guidelines? And no matter what OCD is saying, I'm going to follow those. So I do a yearly checkup every year, whether I like it or not. And I tell my health provider, answer whatever questions they ask, right? So,
Yeah.
and if I follow that rule and the doctor then is concerned about something, they can let me know that, right? And again, that other thing, when there's something, if there's something new or it's, it's persistent, it's pervasive, there's reason to go, oh, I should head to the doctor, then I
Yeah.
won't ignore that either, right? I'm going to
Right.
go ahead and go. Yeah, and there's lots of reasons people will avoid the doctor. Sometimes it's fear of the germs and things that are at the doctor's office or at the hospital. I have some people are like, that would be the worst place I could ever go. There's sick people everywhere. There's germs
Right.
everywhere.
Right.
Yeah. So yeah, yeah. Um, oh yeah, I see somebody, some examples for some exposure therapy to fear of cancer. Yeah, yeah. So, first I want to say, I hate to give sort of a specific, what exposure therapy would be specific, for any one person, because we really do, at least I know we do here at NOCD, we do a really good functional assessment, which means we really invite you to talk with us about all of your triggers. We have you list those out and we go through what your feared outcome is, and we use all of that information to develop a really specific individualized exposure hierarchy, which is really just a list of activities, some bravery challenges, things we're going to do to kind of face that fear so that we can practice not doing the compulsion. And we get some low level ones, some medium, and some high. And that sort of serves as our roadmap for treatment. And where do we start on this little road trip? We start closer to the bottom of that hierarchy or fear ladder. But I'll give you some generic examples. This might not be right for you who wrote this question, but I'll give you some examples of the kinds of things we do. So, I'm thinking of, once I know what triggers you, I'm like, how can I have this person interacting with this triggers? Let's say it triggers you, to just say the word cancer for some people.
Yeah.
I know when I see the word cancer, there's a little kick to it. For someone with OCD, there might be a big kick to it, like just even saying the word, hearing the word, reading the word. That would be an example of maybe just a lower level exposure. So what we would do is have you write that word, say the word, and then practice the most important part of ERP, right? Which is the RP, which is where we work really hard not to do compulsions, because doing those compulsions is what keeps you in that cycle. So it might be not ruminating. It might be not checking your body for signs. It depends, what kind of cancer you might be worried about. And it could include things like reading cancer statistics. It could include things like watching videos from people talking about the particular type of cancer that you fear the most.
Mm-hmm.
And even sometimes we have you writing scripts. So we have you write sort of it's an imaginal exercise, but it can be very, very triggering and very helpful to get somebody's anxiety up, where we say, I head to my doctor's and he tells me I have cancer, right? And I'm feeling scared and my heart's racing, so we sort of write a really in-depth story that sort of ends in that worst case scenario. We have you read that or even listen to it, kind of create a little tape of it again and again and again until we finally accept, yeah, I could get cancer. And the fact is, any one of us could have it right now or could get it in the near future. And that's really hard for, I think, most of us to accept. But certainly when you have OCD in that area, it feels unmanageable. It feels undoable even to accept that uncertainty. Like, I have to be certain that I don't have it. But really, none of us can be. Because even if I got a test today, got all the tests today, maybe something happens next month or a year from now. And so we sort of have to decide, I'm going to do what's reasonable, which is maybe get my yearly checkup, get your mammogram, get all those other little tests that we need to do. And there's recommendations out there for the whole public. There's general health recommendations for how we might help detect some of those things or even prevent some of those things, with healthy diet and exercise. And we want to, in general, follow those things. But yeah, but that would be, some examples, reading scripts that are really tough, but videos, yeah. Again, it would be very tailored, though, to the individual, depending on because two people can have contamination OCD or health OCD, but their hierarchies would look very, very different depending on their triggers, how those triggers trigger for them, and what that feared outcome is, because we actually want to test out that feared outcome. OCD says, if you don't do these compulsions, this terrible, awful thing will happen. And we have to create some exposures that kind of help us test that out. We're going to see if, maybe let's see what happens. Yeah, and that sounds scary, but that's what we do with ERP.
Right. A little bit of short-term distress for longer-term gain.
Yes. Yeah. Yes.
Let's see. We are starting to wind down a little bit. We'll continue to take a couple of questions here. We've got a few. And the next one up, how would you work with a child who has illness, anxiety, or health OCD? Are there different things to consider as far as ERP treatment? ERP treatment, believe it or not, in principle would be the same direction. We would engage in exposures and respond in a different way or not respond at all. With kiddos, we do take into consideration age-appropriate exposures. We may be a little bit more creative in the types of exposures that we may do. We may play games. We may do coloring pages. We may play with dolls for exposures. We may involve family members with doing the exposures. Family is really important when we're working with kiddos because sometimes the family is actually part of the OCD process through a process called accommodation. We inadvertently accommodate the OCD into the family because it helps our child feel better. And so it can be a family affair where we work with mom, dad, caregiver, brothers, sisters, other people in the family to also be engaged in not providing reassurance or providing extra hand soap in the house for exposures, limiting the time that you're allowed to be in the bathroom, sort of thing. So they would differ slightly in that respect. Again, making sure that everything is age appropriate. And we do have therapists here. All of our therapists are trained in working with children and adolescents and can provide ERP services to children, teens, adults, and to the family as well.
And I always think, what a gift if you recognize that your child is struggling with really any of the subtypes, but certainly this one, of course, to get them into treatment sooner than later. Imagine, a child having those skills then to be able to really accept uncertainty and to face these fears in a different way. That's really going to change the way they approach life in general. So we often get people come to us much later, in life, and they've practiced compulsions for so long. It's been so hard. I just think what a gift if your child can sort of learn these ways of dealing with those thoughts and those feelings differently from an early age. That's just a gift. And you're right. The biggest difference is, right, we do an accommodation reduction plan. We help parents do that just while their child is doing that ERP, and they kind of coordinate. But yeah.
No, absolutely.
Okay.
Do you want to take one more question here, Jamie, before we wrap up?
Sure. Let's see. Yeah, so have you ever worked with clients who have health anxiety or health OCD and have an actual medical issue, such as a chronic illness? Yeah, it seems tricky for the client to figure out what is OCD and what is an actual medical issue, for example. Yeah, so Absolutely. And OCD likes to hop on board of things like medical issues and illnesses. So yeah, that absolutely does happen. And the truth is, you won't always know in the moment for sure which is which, and that's part of what you kind of have to accept the uncertainty about, while also again continuing to work with a medical provider that has hopefully taught you what types of things are going to require medication or certain treatments. And what OCD does then is hops on board of that and says, and you better ruminate about it, and you better Google it more, and you better attend to it. In fact, maybe you better stay home, maybe you better. So he's going to give you a whole lot of things that probably your doctor didn't say were necessary. Because I think your doctor probably wants you to live a pretty good life, even though you do live with a chronic illness. So I think it can be tricky, and your brain won't always know in that moment. So you may have to say, I don't know for sure if this is something I need to do something about right now or not. I'm going to go ahead and, keep eating dinner with my family. And if after that I still want to do something about it, maybe I will.
Yeah.
Or maybe I'll try to remember, my doctor said I'm only going to need to do something if this happens or this happens. So, yeah.
Yeah. This is where individualized care and coordination with other providers can be really helpful for us to be able to determine what would be appropriate to incorporate into our treatment plan for exposure work, and also give us some insight as to what are the signs and symptoms that we need to be looking out for, and what might fall outside of what the doctor or your care team is recommending as far as interventions go.
Yeah.
Well, we are coming down to the last couple of minutes of the hour, and I would just like to thank everybody for showing up and coming with such awesome questions. I really appreciate it. It's been fun. And Jamie, if you have any closing remarks.
Yeah, I think I remember them saying that this would be recorded and I think sent out to everybody, so that's kind of nice too.
Yeah,
And I would just say if you feel like you're struggling with one of these things, here at NOCD we treat all of those sort of areas that we talked about today, all of them.
yeah,
And thankfully all of our therapists are trained in the gold standard of treatment for all of those things, which is ERP. And so
yeah.
for children as well and adults. And so I hope if you're struggling with any of these and you need a little extra support, book a call and sign up and get some support.
Absolutely, absolutely. It's a free 15-minute call that you can schedule.
Yeah.
You can talk with a care advocate,
Yeah,
and they
like,
can
do you
talk to you
take my
about
insurance? They answer all those questions. What is treatment like? Yeah, so yeah,
all that good stuff. All
yeah,
that good stuff.
yeah.
Well, again, thank you for joining us from all across the country, and including other places as well.
Mhm.
Maybe we will see you all around again. I hope you have a wonderful, wonderful weekend, and we will see you later.
All right. Bye, everybody.
Take
Bye,
care.
Heather.
Bye.